The next essential I like to coach is touch and be touched, but I automatically include with permission. I have been in a hospital for a year as a patient. I've worked in a hospital for the last year as a rehab physical therapist, and I can guarantee you hospital patients are never touched, not unless they're getting a blood pressure or an IV. So when I meet my patient, I always ask them permission, but I say I've had the great good fortune of working with world champion kickboxers and champion Golden Glove boxers, and I do a boxer's rub that is pain-free and will help you improve your balance the same way we're coaching boxers not to fall down. And so if you let me and give me permission, please coach me if I should go harder or softer. And then I do a very basic massage to their superior trapezius. I rub thoracic vertebra 2, which goes to the heart, and thoracic vertebra 3, which goes to the lungs. So I'll massage around there. That's heart and lungs. And then I work my way up the paravertebral muscles on the neck and make sure I loosen the area at the medulla oblongata, base of their skull. A fact, medulla oblongata is the only organ that is never operated on. It does too many essential functions, 3 of which include heart rate, respiration, and blood pressure. And so that area needs to be loose if that patient is going to breathe and heal and function properly. So after I do that for 1 to 3 minutes, the patient coaching me throughout, harder or softer, they always feel better. They not only feel better, sometimes they even tear up. They're really kicking on their healing parasympathetic nervous system. And ideally, if a family member is there or I'm in a family's home, I encourage the family member to do the massage. I get them in front of the patient because they're dying to help in the first place. And then while they're doing that massage to them, I'm doing it on the family member. The soup traps, thoracic vertebra 2 and 3, paravertebrals up alongside the neck, medulla oblongata, get that wobbly, bobbly head, always encouraging the question, should we go harder or softer? Because the patient has to feel good. The feel good is what triggers the parasympathetic nervous system and is essential to all humans. That aspect of joy is something I think is just much neglected in recovery of everyone after a catastrophic injury. Joy is an automatic healing and boosting of your immune system. If you've ever seen someone who you may consider maybe unattractive in a wheelchair, let's say I've seen in a hospital, if they're expressing joy and smiling and interacting, everybody in the hospital is attracted to them. It's automatically attractive. It's automatically healing. It's automatically a sharing activity. And I encourage my cancer patients to not neglect this idea of being joyful.